Well, today we're going to go over a short video on things you can do to relieve toothache pain without going to the dentist. For starters, you may not even be able to go to the dentist. It might be the middle of the night. What can you do? We're going to cover two areas, non-drug and some drugs that you may have in the medicine cabinet or can buy over the counter without getting a prescription. The non-drug modalities that may relieve pain are cold, first of all, ice packs. And you've probably seen pictures of people with ice or even heat wrapped around their head. The ice seems to help. The heat may or may not help. At times it can reduce inflammation, reduce swelling, and sort of dissipate infection. But at other times it may just amplify the chemical reactions that are causing you pain. So for heat, you might try it. If it doesn't work, just stop. Cold almost always will numb up the area at least, and that's certainly a relief. There are two kinds of rinses that may help. One is basically saltwater rinse. You just prepare some. I'd say put about a teaspoon of salt into a little more than half a coffee mug's worth of water. Warm water. It doesn't have to be hot. Just whatever would be comfortable drinking tea. So you've got your warm salt water. You mix up the salt in it, and then sip it, rinse that area, swish it around, spit it out. It's probably good for you anyway, and it may or may not cause some pain relief. More often than not, it's at least helpful. The other thing you can rinse with is hydrogen peroxide. Hydrogen peroxide comes in the brown light resistant bottle from the drugstore at 3% concentration. It's an effective cleaner and painkiller, but it's too strong at that strength. Mix it half and half with water. Let it be room temperature, and then rinse with that. If it helps, you'll just have to try it and see. It can be very effective. Again, it depends on what's causing your toothache. Another thing, I wouldn't call it a rinse, is caffeine. Caffeine is not a painkiller, but when used with other pain relief, it may make it more effective, particularly, as we'll get to later, the over-the-counter pain pills. But don't use it at night. It's hard enough to sleep with a toothache anyway. But consider a sip of coffee or having a cup of tea, especially if you're trying something else like the heat. It may just make it work better. Finally, we're going to come to something that really will work well, and that's clove oil. Clove oil is available, if you look hard enough, at health food stores and sometimes in the spice area of a grocery store or even at a drugstore. Try and find some and have it in your medicine cabinet just in case you need it, because it may be hard to find when you really want it in the middle of the night. But clove oil, you can put some on your fingertip and rub it on the sore area, or if you have a tooth with a hole in it, it's most effective to take a tiny cotton ball. Just pull a wisp of cotton off of a cotton ball and ball it up, moisten it with clove oil, not soaking wet, and then with your finger or tweezers try to get it into the hole in your tooth, and it really will work. So you should be prepared to do this one. If there's not a hole in the tooth, put it on the sore area, or try to poke it in between with a toothpick, two teeth where it hurts. Just keep it in the vicinity, and it will calm down those nerves and make it hurt less. Next, we're going to get into some electronic means. First, if you have a TENS unit, which is transcutaneous electrical nerve stimulation. It's a little black box with a couple of electrodes that you can put in the area where you have pain. They're often sold for backache or neck pain, and they do seem to work. It's a bit harder to figure out how to use it for dental pain, but if you put one on the jaw and one on the back of the head or one on either side, you turn up the unit until it's sort of shocking you a little, then you back it off to where that's tolerable, and with any luck it'll divert the nerves from carrying the toothache pain and sort of occupy them otherwise. After a while, you'll notice you're not feeling it. You may be able to turn the TENS unit up a little more. If it helps, great, you should try it. If you don't have a TENS unit, I wouldn't buy one expecting it to relieve dental pain consistently. As all of these things, it may or may not work. The next thing is a laser pointer. If you can shine a regular red laser pointer at your tooth or the area of the gum where it hurts, or even from the outside, just put it on there and push the button, then that light, even just used for under a minute a couple of times a day, will promote healing. And healing is not always what stops pain, but again, you've probably got one in the house somewhere. You might as well take it away from the cat toy and try it, because it can help, and it will help healing occur. The last thing is your television. If you've got tooth pain in the middle of the night, bad enough to wake you up, don't try to continue to sleep. It's not going to work. Just get up and go watch some TV, preferably a comedy. It seems like something that diverts your mind from the pain will actually relieve the pain. Again, it's a question of occupying the pain pathways with something else, and comedies seem to be the best. So try it. Now we're going to go over some over-the-counter pain medicines. These can be a lifesaver, so you should know this stuff. Tylenol by itself, not much good for pain relief, but it boosts other pain relievers, so you will be using it, and you should have some in your medicine cabinet. Just taking it by itself hardly works at all, but in combination with other things, it's a booster. It does get eliminated by the liver, and you need to be aware of that. We'll bring it up later. If you take too much Tylenol, you can have serious liver failure, no question. So you do want to keep track of the Tylenol you're taking and Tylenol that might be in other medicines that you're taking and don't realize it. Tylenol is acetaminophen. We'll come on to aspirin. Aspirin, also a very effective pain reliever, great for headaches, not the most effective for toothaches. It will help, but it might not be good for severe toothaches. It is also an irritant to the stomach and a blood thinner. These things are sometimes beneficial, at least the blood thinning, but if you're taking medicine very often, aspirin can have some unpleasant side effects or even cause stomach bleeding, which is very serious if you're using it for days and days at a time. I wouldn't make it my go-to for toothaches. Ibuprofen is very effective for dental pain. It works powerfully to relieve inflammation. Inflammation is the cause of most dental pain, either as a result of trauma or breakage or nerve exposure, or because of infection. So anything that can reduce inflammation will help reduce the pain of dental pain. It's eliminated by the kidneys, and it also, ibuprofen, also known as Motrin or Advil, often comes in a liquid form, a liquid gel. The liquid gel form works faster and you need less of it. So liquid gel form is worth buying and having in your medicine cabinet. Naproxen or naproxen or Aleve is a different kind of non-steroidal anti-inflammatory drug. It lasts longer, and for mild dental pain it can be a big plus. You only need to take it twice a day, and it might be all that you need to get over it until you can deal with what's causing the pain. Naproxen is eliminated by liver and kidneys. It's actually fairly safe since you're not taking very much of it. Combinations of these drugs are the most effective. So a combination of ibuprofen and acetaminophen, that is Advil and Tylenol, is the most effective painkiller that you can get over the counter, and it rivals that dentists can give you with narcotics in them. It may even be better than some narcotics. The Advil brand produces a combination pill called Advil Dual Action that contains both ibuprofen and acetaminophen in a dosage form that you can take just 2, and it'll give you 6 to 8 hours of moderate to severe pain relief. This stuff really works. You can take 3, but it doesn't work much better than 2. So I would consider just taking 2 of these, and if you want to add a little caffeine or put some heat on it as well, you should get sufficient pain relief even later to go back to sleep. So other combinations include Excedrin Migraine, which contains aspirin, acetaminophen, and caffeine. This stuff is very effective, more so for headaches and toothaches. But if you have it and you take it for a toothache, it will work. Maybe not as good as the Advil Dual Action. So that's Excedrin Migraine. Also, BC powder contains aspirin and caffeine, no acetaminophen. So we don't think it's quite as effective for toothaches. Again, it may be fine for headaches. People do take BC powder or even an aspirin tablet and place them in the mouth next to the sore tooth. The scientists say that isn't going to help because that's not how those drugs work. People that do it often claim it works really good. I will tell you, it will leave a chemical burn, which can be pretty nasty and hurt just as bad in a day or 2 as the toothache did when you use the powder. So I don't recommend that you place these powders in the mouth. Another important medication that you should have at home is benzocaine. Benzocaine is Oragel or Numzit. It's available in a variety of brands. It's called benzocaine. The maximum strength, which is available to you over the counter, is 20%. That's all that dentists can get. It's the stuff they rub on the gum before they give a shot. And if you can just rub it on the painful area and it works, you're in great shape. Sometimes the pain is too deep inside the jaw or the tooth to be reached by benzocaine, but it's also worth a try. Benzocaine may sting if you put it on certain irritated areas. It usually works fine. If it works for you, it has a couple of drawbacks. It doesn't last very long, but who cares if it stops the pain? And it'll numb up your tongue, which is kind of annoying, unless that's what hurts. Maximum doses of these medicines you can take are something to keep an eye on. That's the maximum dose per day of aspirin, 4,000 milligrams. Don't take more than that. Of Tylenol, 4,000 milligrams. Under no circumstances take more than that. And even these doses should not be taken for more than a few days at a time. Naproxen, you can take up to 1,100 milligrams a day. That's more than they'll say on the label and more than would actually help. So naproxen at lower doses will help more than it will at maximum doses anyway. Ibuprofen, you can take up to 3,200 milligrams a day. I wouldn't go that high if you could help it, and you'll find your pain relief kicks in at much lower daily doses than that. Again, stay away from these maximum doses simply because they may overload your kidneys or your liver or your stomach and lead to even more serious problems. Finally, remember there is someone who can help get rid of this pain 100% and completely and probably permanently. And that man or woman is a dentist, and they actually have an office waiting for you because they want to help you. So if you put up with this pain for long enough, consider visiting your dentist.